team members that are working on the ground, and of course, but for the relationship with Dr. Willis and Dr. Santora, we would have never been able to begin this work, which started on March 13th, 2020. So with that, I'm going to pass this on to, oh, and a reminder, it's being video recorded. It will be available within 24 hours, usually about 12 hours to everyone. And we're also in the process of, we'll make sure we have live translation. So Michelle, thank you for saying a few words to any of our Spanish speakers that are on this call.
Thank you, Mary Jane. Bienvenidos a reunión de la Comunidad de Escuelas y Salud Pública del Condado de Marin. Este webinar se transmite simultáneamente en español. Haga clic en el botón de interpretación del idioma que aparece en su pantalla si desea escuchar esto en español. Muchas gracias a Marta Bitton, que es nuestra intérprete esta tarde. Gracias.
Great, thank you very much. Okay, now we'll pass this on to Dr. Willis. Thank you, Matt.
Great. Good morning, everyone. Great to be with you. We are at a pivotal time here in our process of reopening schools safely in Marin. I think this is just in the past week, a lot has happened both locally and at the CDC that I think makes it really opportune that we had scheduled this meeting for today. I'll just share my slides. Can you see those? Yeah, okay, great. So this is just a reminder of the mission of the Department of Health and Human Services. Dr. Santora and I are public servants. Our salaries are paid by our taxpayers. And we are part of the health side of Health and Human Services. Our mission is to promote and protect the health, well-being, self-sufficiency, and safety for all in Marin. And we take that little word "all" very seriously in the way we approach our public health policies. And then, reminding us and grounding us back in, this is something that we've been sharing in these conversations really from the start, as Mary Jane said, from March last year, when we were among those first counties to close schools, as we started seeing increased COVID-19 activity across the region, and really trying to define the principles that we would use as we reopen schools, and looking to the World Health Organization definition of health from the Constitution of 1948. It defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And this has really been an important organizer for our thinking at every step, not just in our approach to schools, but in our approach to all policies relating to COVID-19 over the past year. Recognize that we are balancing harms associated with transmission with harms associated with restrictive policies. I'll just go quickly through the kind of where we are as a county right now, as we're emerging out of what was our most serious surge in cases over the past winter. We've had now over 11,000 cases, almost 400,000 people have been tested. We have vaccinated over 100,000 residents now. And this is an updated version of our public-facing website, and inviting anyone to browse that website. We add new features every week at coronavirus.marinhhs.org. And you'll also find there our epidemic curve. This is shows our little surge in March that led to the first closure of schools, and then the more dramatic surge we saw in July, characterized by the tragic events at San Quentin State Prison with over 2,000 inmates there, and then also characterized by 80% of those patients in our July and August surge were among our Latinx residents, and then the largest surge that was part of a national and statewide surge in December and January. And we've really seen improvements in case counts really since then, with a very small but potentially concerning uptick. Our progress had been relatively steady all the way through until just the past week or so, where we've seen sort of a stalling out in that middle of the orange tier numbers. With actually over the past weekend, there was 50 cases over the weekend, 28 one day, 22 the next. So that was, a concern to us that we need to make sure that we're not jumping the gun in terms of relaxing our policies, relaxing our behavior, travel, et cetera. And Dr. Santora will talk more about that in a bit. So what does it mean to be in the orange tier? We're moving today into the orange tier. Our case rates are 2.5 cases per 100,000 residents. So tomorrow will be the first day in orange. It'll be announced by the governor today in an hour or so, but these are the numbers, so we know that we're moving. Grocery retail, 100% capacity, indoor dining at 50%, movie theaters and museums, 50%. Houses of worship, weddings and funerals are 50% indoors. Gyms are moving from 10% to 25% indoor capacity, and pools now indoors can be open. Bars that don't serve food are open outdoors. Non-essential offices now can be opened for people to come to work, although we still recommend people work remotely as much as possible. Higher education is open to 50% capacity for indoor lectures, and youth sports are tied to the tiers, and Dr. Santora will speak more about that shortly. This is our dashboard that shows how we're doing with regards to our schools. And that bottom donut that has all green shows that 100% of our schools in Marin County are open to some form of in-person learning, which is a really exciting step for us. We've been steadily making progress against this, this indicator continuously. We have now over 101.4 million student days accumulated each day. 20,000 or so or more students are in some form of in-person learning in Marin County. So that number rises rapidly. And with all those total student days accumulated, still about 11 cases of suspected in-school transmission, either between students or between adults. No cases yet of any student to adult transmission in our school settings. This is our vaccination rate. So another point of progress for us. Over 100,000 residents have received at least one dose of vaccine. If we take into account that only residents above age 16 are eligible to be vaccinated because our children were not part of those clinical trials that allowed for the emergency use authorization for the 3 formulations we're using now, we're almost at about 50% of all those eligible to be vaccinated have been vaccinated in Marin County with at least one dose. This has about a week lag, so it's likely that we're actually more than 50% with 151,000 doses administered to our population thus far. And that puts us at the highest rate of vaccinations in any of the medium or large counties in the state of California. And this is thanks to really just aggressive and wonderful partnership, radical collaboration across our system with our federal qualified health centers, our community clinics, Kaiser Permanente, Marin Health, Sutter, as well as Marin County Public Health, really working together to vaccinate our community. And probably the strongest evidence of that was the Super Saturdays we've had for our educators, where we opened up the Marin Center to over 2,000 educators and related school staff for four consecutive Saturdays, where Kaiser Permanente and Marin Health and Sutter and Marin Public Health, Emergency Medical Services, Fire, Marin County Office of Education staff all came together really in a joint effort to protect our schools. And we have now hopefully vaccinated anybody in the school community who seeks to be vaccinated by offering those opportunities. This is how we're doing in terms of our age groups. We've vaccinated about 40% of those age 35 to 64, and about 75% of those residents above age 65 in Marin County. So I thought it would be interesting and important to share kind of where we see this going in terms of our time frame. And this is good news. We had hoped to vaccinate all of our Marin County adults by the end of June. And that was one of the sort of the organizing goals for the collaboration we have with our hospitals and healthcare partners in public health. At the current pace of about 3,700 doses per day on average, if we assume there's about 100,000 remaining unvaccinated adults in Marin, and then we assume that it's going to be a mix of 1 and 2 dose regimens ongoing, we would hit that finish line of having vaccinated all of our adults in 54 days, which brings us to about mid-May. And it would be even sooner as supplies increase. We do not expect supplies to decrease. In fact, we expect supplies to increase. So it could be even earlier than that we would have our community actually fully vaccinated, at least those that wish to be vaccinated. Again, our goal is at least 80%. To have that herd immunity, we need at least 80% vaccination rates. And then children, because the phase 3 clinical trials are still happening right now for kids, we wouldn't expect actually to be able to vaccinate until late summer or fall. Once the studies are done, safety and efficacy is determined for those age groups. So it's late summer and fall. So there may be actually sort of a little bit of a hiatus period where we're not vaccinating as many, and then have another vaccination drive that might engage schools more completely, actually with on-site vaccination operations, et cetera, in school settings late summer or fall, depending on when they're authorized. 2 important CDC reports released last week, and I think really do help organize this conversation. The first is that the CDC revised their recommendations for schools to allow for 3 feet of physical distance between students. And this was based on data that has accrued over the past year globally. And then importantly, some studies in the United States, an important study released, Clinical Infectious Diseases, looking at Massachusetts schools that showed, looking at basically all schools in Massachusetts and showed that there was no difference in transmission rates between schools that had 6 feet distance versus 3 feet distance as their policies. Similar studies out of Florida, North Carolina, Utah, and then of course the body of international evidence as well. That accumulation of evidence that had really started last year, Lancet study that we've been referring to starting in June of 2020, led to our recommendations of 4 feet. And we're feeling that the data we're looking to has been validated and in fact reinforced in CDC's guidance to move to in fact 3 feet. And then the other important study that was released by CDC was that distance learning is associated with greater harm, both socially and physically. I'm just going to summarize those 2 studies really briefly here. So this was the guidance of March 18th, 2021, the revised physical distancing recommendations, at least 3 feet between students in classrooms when facial covering and other routine measures are in place. Still recommending 6 feet when children can't cover their faces, for example, when they're eating, and 6 feet between adults and students. They also clarified the importance of ventilation. We talked about this before, that even windows reduced, open about six inches, at least 2 windows at a standard classroom size has that adequate 5 cycles per hour ventilation. And then they also removed the recommendation for physical barriers, recognizing that when these other measures are in place, that is sufficient. The state of California, soon after the CDC issued that recommendation, has also followed suit, and now California Department of Public Health is also recommending 3 feet between students in classrooms. And that is Marin County's practice. And Dr. Santor will review how we're taking that into account in our own guidance. And then the other important report the CDC released was the association of children's mode of school instruction with child and parent experiences well-being during the pandemic. And it was a national study of about 1,300 respondents conducted in November of last year. About half were doing virtual instruction, and the other half had some form of in-person instruction. And it was children 5 to 12 years old. This was published in the MMWR on March 19th. And just to summarize some of the key findings, what they found was that, all students relative to COVID days had decreased physical activity. But those who were in virtual learning had even a greater decrease in physical activity compared to students who were actually in person. About half, basically half as much twice as much physical activity among those that were in person learning. Also, same with time outdoors. Those that were involved in in-person learning had more time outdoors. Those involved in in-person learning also had more time with friends and had better health, mental health. So everyone's mental health was perceived in this study to have worsened over the period of the pandemic, but there seemed to be a protective effect in terms of for those that were involved in in-person learning. So this is something that we have been talking about, has been sort of anecdotally clear to many of us in our communities and our families, but we are now seeing an accumulation of more objective evidence for that. So I've shared lots of reasons for hope and optimism. Our case rates are going down, our vaccination rates are going up. We're recognizing more and more that the things that we've been doing in Marin County to reopen schools safely are being recognized nationally as standards, and it reinforces what we're doing locally. But what can still go wrong? And we just want to spend a few minutes talking about what we need to continue to do to be able to continue to reopen safely. One concern is that mask fatigue and breakdown of non-pharmaceutical interventions. As spring fever sets in, that people would be traveling more, that would be gathering. We're not ready yet. Despite the fact that half of us are vaccinated, that means half are not, and then none of our children are. So more than half of our population is still not vaccinated. And we need to recognize that the virus is still flowing in our community, even at 2.5 cases per 100,000 residents per day. That's still about 10 cases a day. And so the virus is certainly part of our community. Importantly, also there are potentially pockets of immunologic inequity that could sustain transmission. If there are groups of people, either by virtue of lacking access to the vaccine or because of cultural reasons or beliefs, are not vaccinated, those groups become potential risks for obviously people from within that group, but also for the risk for the community because it can spread outside of that group. We're concerned about emergence of more transmissible or less immunologically susceptible variants. The B.1.1.7 variant, the so-called UK variant, is gaining a foothold in other parts of the United States. Michigan, New Jersey, they're seeing relatively dramatic increases in cases, primarily attributable to this variant. In the state of California, we're now looking at only about 6% of our cases are B.1.1.7, but that could increase relatively quickly. So we're in a race now with trying to get as many people vaccinated as possible before the variants take a foothold. If we are too relaxed in our own behavior, that will allow that variant to move much more quickly through our communities and could threaten our progress. And then, of course, another vulnerability would be in ignoring the fact that this is a global pandemic and that whatever we do within Marin County or the state of California needs to be seen in the context of what's happening around the world. And in fact, most countries don't have near access to the vaccinations that we do. So I will end there and hand it over to Dr. Santoro, who you know well, who will offer more about where we're seeing transmission happening in our community. Thank you. I can advance for you, Lisa.
No, you can't. I took the steering wheel from you.
Oh, okay.
So thank you, though, and thank you, everyone, for joining us today. It is a beautiful spring day, and I know we all do have our own bits of spring fever. I did, for the first time, walked out of my house and into my car without a face covering, and I think that just shows that we're all susceptible to that fatigue. Fortunately, there's so many face coverings and masks in my car that I was able to drum one up, but I think that's, again, just the critical importance of us as a community making thoughtful decisions as we reopen, and the real risk that we may have to go back to a red tier in weeks to come if we don't stick together for the next couple of weeks. You see how hard we've been working to vaccinate to create immunity in our community. That rhymes nicely, but it's still a race, and our behaviors are what is going to threaten that regression back to a red tier, which really could continue to affect families who have been struggling economically, local businesses. When we move to tiers, it allows businesses to open more widely and to start stabilizing and rebuilding their financial picture as local businesses in our community. So again, it's all of us in this together. We have seen stories and heard many stories, and as we continue to investigate cases, that the drivers of transmission in our community continue to be three things. It's gatherings, travel, and activities related to sports in our community. And that's been probably the most significant change now that sports have reopened. I had the fun of seeing sports being done well at the San Rafael High School campus, where there was kids in this pool, and Swim Marin was following their guidance. We had the baseball teams competing. We had lacrosse teams practicing, all with face coverings, all following guidance. But we also get the pictures in our inbox of where people are not following that guidance. And the guidance is written and intended really to protect us as a community from falling back into the red tier. So it's all that activities that are around us that we all want to jump back in, literally into the pool and swim and be free, but we have to really be cautious so we can stay in orange. I think that's our new goal, will be staying in orange, and give public health time and our partners time to vaccinate this community so we can get to yellow and potentially a green zone this summer, but it's only if we stick together. I just want to travel. We have spring break coming up, so we will be strongly recommending quarantine after any out-of-state travel. We do have an ability to test to shorten that travel, but make sure you check the CDC site and your school sites if you do engage in travel. We have had cases return to schools because of out-of-state travel. And I think people underestimate, one of the mistakes that we're seeing is that they'll test their children and students to get them back to school, but they're not testing the entire family. And that's missing the opportunity for your testing to get your kids back to school. But if you don't test the entire family that participated in out-of-state travel, you're gonna miss the opportunity of identifying what we call that index case in a household, the person who did contract COVID-19 and potentially risk exposure in the school environment. We're seeing school guidance from the state change very quickly and rapidly. It's not the activity itself per se. There is heavy exertion and close contact in some of the sports. But one of the primary concerns we have is the pre-event and post-event activities. So more families, households mixing, not wearing face coverings, drinking at games, after games, also carpooling. All of those activities around sports play a role while we'll continue to see clusters and outbreaks of COVID cases related to sports in our community. We are seeing updates and guidance. We've heard from the state that they'll be updating guidance on spectators. And again, what is being allowed for outdoor events in the state for private businesses is more than what's allowed for most of our public schools, because they have the dollars to spend on having reservation systems and tracking, assigned seating, supervision, really to create the safest possible environment when we have outdoor events. Our schools and clubs don't have the same dollars and same budgets. So again, really heeding the state guidance. It's designed to try and keep us moving as a state toward that green tier that isn't even posted yet on the state's website. And consult with us if you have any questions around guidance. We will reach out directly to sports clubs and teams when we hear that they're not following the state guidance, to make sure they understand the state guidance, and would encourage everyone to visit the California Interscholastic Federation Sports Guidance. They have done an excellent job doing a sport by sport document, and with all sports, except if you're in the pool, masks are always recommended, even if there's heavy exertion. So we've heard of some lacrosse teams not using face coverings. The expectation, absolutely, unless you're in a pool, that you should be wearing a mask, even if you're have heavy exertion, and that also includes football. So again, that's just another strategy of protecting, especially that adolescent population, where we see COVID-19 behave more like adults in the adolescent population, and adolescents would be an under-immunized population in our community. So now on to our guidance. We are updating it again, and it's I'm just really proud of our efforts. We've been science-based since the beginning, so many of the guidance that you have seen across the state emerge and even the CDC, I believe that we've informed that as we have led in Marin County. And again, to echo Mary Jane's just gratitude to school leadership, staff, parent volunteers, and our community working together to get our students back into school where it is a healthier place for them to be.
Oh, Lisa, you froze. Oh. Call Lisa Santora Mobile.
Can you see Mary Jane?
Yeah, I can see the unvaccinated, the beginning of the slideshow, but Lisa has dropped off here for a minute, it looks like. So hopefully she'll be jumping right back on after
Okay.
she froze. Thanks everybody for being patient with the technology here.
Yeah, so Mary Jane, Lisa just said her computer overheated. She's restarting. If Matt could take a few slides, she'll go right back with us.
Yeah, I'm happy to take the slides. I just need someone to advance them. Unfortunately, I'm unable to advance the slides.
Hey, Mike, can we advance them?
Yeah, I'll share my screen and I'll advance.
Thank you.
Yeah, sorry everyone. So I can start walking through the. So what we will be summarizing is only those elements of the 30-point plan that have been revised since the last revision, and these revisions are primarily informed by what California Department of Public Health and what CDC has offered by way of revisions. As you can imagine, as this has rolled forward, there's been an evolution of the processes and protocols that the CDC and CDPH are advancing that we're informing our practice. Mike, if you could go just to the beginning of it's probably around slide 20. There you go. Yeah, slide 21. Great. Next slide, please. So these are our hope is with accelerated vaccine availability, as I discussed, and distribution of the return to full and distribution of vaccine, we're hoping to have a full return to in-person instruction 5 days per week before the end of the school year, especially now as we're removing the barrier of 4 feet. I think the last time I spoke with you all, we were still at the 4-foot level. There had been some advocacy and some questions about whether or not we could move to 3 feet. At that time, the state would have required a variety of new protocols to be in place, including more frequent testing to move to the 3-foot distance. We were heading in that direction, and then the CDC and CDPH opened it up to 3 feet, as it had been at 6 feet previously. And so we're removing that sort of practical and logistical barrier. We're hoping that this is the invitation to open up to full classroom instruction by spring. Next, please. So this is guideline number 6 of the health screening. Health screening for students and staff are conducted as advised by public health. Parents, caregivers, or guardians should be strongly encouraged to monitor students for symptoms of infectious illness every day through home-based symptom screening, and staff should conduct daily health self-assessment. So this is different, and that this clarifies that we are not expecting on-site symptom screening by way of a form or other process on site, but rather this is self-monitoring through home-based symptom screenings for both students and through their parents and staff. Next, please. Guideline number 8, testing strategies. So schools and districts will cooperate with public health to support testing strategies to mitigate transmission of COVID-19, including testing of staff who have regular daily contact with students before site-based classroom instruction is resumed, and no less than every month unless fully vaccinated. What's important here is that for staff that are now fully vaccinated, the expectation of monthly testing has been relieved. We do not require monthly testing for fully vaccinated staff any longer. However, if vaccinated staff members develop COVID-like symptoms or has close contact with someone confirmed with COVID-19, testing is recommended. And that's per CDC and CDPH recommendations. Next slide, please. And it looks like Dr. Santora is back. Lisa, do you want to take it from here?
Sure, sorry about that. I'm working too hard, my computer overheated. So jumping on to exposure protocols, we will be updating our exposure protocols now that we are in the orange tier. We will no longer require classroom closures after a known positive case in on the school campus. We will be working with the schools to engage in contact tracing, where we identify on the school campus who's tested positive and who are their close contacts on the school campus. So this is a shift, and it's driven by what you've seen with the original slide that Dr. Willis showed, that we're not seeing school-based transmission. So that will be updated and shared hopefully today. And again, thankful for the work of the public health liaisons in supporting that shift. But we do want to make sure that people do notify us of any possible exposure. And if anyone, this is probably one key point that can help us avoid excluding students from class, even if it's not a classroom closure, is if anyone is getting tested in the household for COVID-19, to exclude students of that household until we know the results of that test. That buys us time and helps us to identify who, again, is that index case in a household. And then you're not sending a student to the school campus who may have had an exposure to COVID-19. So you can jump ahead. So again, this is where we introduce in our guidance, the 3 feet distance is permissible in the instructional areas. We need seating charts to be maintained and attendance records, and that will allow us again to support the school in identifying those close contacts, individuals who's been less than 6 feet for more than 15 minutes, so we can exclude any close contacts from school rather than having classroom-based closures. So you can jump ahead. So now we have mixing is allowed. So this has been a concern in the beginning. We want to maintain stable classrooms at grade levels, and we do know that as we move through middle and high schools that classes are mixed. We can have limited mixing as long as we have accurate attendance and it's maintained on a daily basis. And that's critical for us, again, especially as we are coming back and we are relaxing. We need to be able to know who close contacts are if there is a positive case on that school campus. But we're excited about this one because there's many supports that students receive at the school campus or at their school that are beyond just the classroom-based education. So this is going to allow more supports for students and also allow the full return of in-person instruction, for example, at the middle and high school levels. Playgrounds, we used to be very strict with playgrounds, and now we're shifting down to just having routine maintenance required for the playgrounds themselves. We're still not recommending that you have a full playground. We still want to maintain those stable groups and who we know who is mixing. So at this point, no mixing yet on the playground, but we can scale back and just having routine maintenance of the play areas. And it's not, you don't need to wipe down the play areas after each group goes on site. Just make sure kids are washing their hands before and after they go to the playground. That's good news. Jump ahead. So again, our face coverings, this is again, just the importance. We are not recommending double face masking, making sure that you have a well-fitted face covering and working with students and staff to make sure they're wearing their face coverings. And this is going to be the key for us for a while to maintain that 3 feet distance, is really enforcing the importance of face covering and making sure it's properly fitted and kids aren't fiddling with those face coverings. Jump ahead. So physical barriers, we just adjusted our language. What the CDC is, they completely removed reference to physical barriers. We have not recommended physical barriers. It was not part of our initial guidance based on the data that was available then. And we just wanted to reinforce that you can use physical barriers. We are not saying you have to remove physical barriers. We know some schools have implemented physical barriers, but really that is not to replace any of the other measures that are in our guidance documents. Jump ahead. So this is a big one for us, and I'll go first, then let Mary Jane jump in. We really still want to limit those non-essential visitors. We're expecting all essential workers are going to adhere to the health and safety guidance in place. And this is the last sentence is the most key part of this, is that any substitutes, contractors, visitors, or volunteers who are working directly with students should be fully vaccinated. So this is not an order. I just want to be clear that this is not an order by the health department. We have not yet issued an order for mandatory vaccination, but we are strongly recommending that any staff that are working directly with students, that they should be vaccinated. Anything you want to say here, Mary Jane?
No, just to add that there, in addition, is not an order for regular staff to be vaccinated at this point. So we are providing opportunities for people to get vaccinated, to ensure that people that want access will have that. You heard from Dr. Willis that we'll be in a position sooner than we thought where everyone in our community will have this access, but that in the end of the story, that it will be, one of the parameters that we'll be looking at. And just for you to know, in a situation like measles, for example, in order to be a substitute teacher in Marin County, you have to have had the measles vaccination. So this is not new to the way we've approached some of these issues, but will be very important. And as a reminder, most of our community-based organizations that are front-facing with students and volunteers have had the opportunity to begin to get vaccinated. And while there'll be others, we'll continue to develop opportunities through the typical system in the county.
You can jump ahead. So we just updated language on number 30 to align with the state's language. We are now, it's no longer required that public health review and approve all site-specific protection plans. It just needs to be aligned with the state. And when any updates are made, those updates should be posted to the school's website. So we're not in a place anymore where people were submitting waivers and we were reviewing and approving. Now we're just in a place where as schools change, and we are anticipating updates and expect to see updates in the CSPs, as they're called now, because of the return to full-time in-person instruction, that they should be posted and updated on their school websites.
Mm-hmm. And so just to remind everybody, the template has been updated with the updated 30-point plan here. So you'll be able to access on the Rethinking Schools website.
All right. And so this is just our last couple of slides. We remain committed to reducing the risk of COVID-19 transmission for the entire school campus. Our goal is all grade levels in Marin County are open, and we continue to implement the school site specific protection plans to continue to maintain the safest possible environment for our school community. Our goal is vaccinating all staff, and I should have added a clause or comma, including school volunteers, because we know school volunteers play a critical role in maintaining the school community. And then as we move forward to the spring, vaccinating all 16 to 18-year-old students as it becomes available. And we're estimating that to be in May, as you saw by Dr. Willis's slide. And then following up even in the fall, we know that there'll be students that were 15 in May, but there'll be 16 as they enter the fall school year that we're ready to vaccinate, because vaccinating is one of the strategies we have to prevent outbreaks and clusters in the school environment. And our goal is returning all students at all grade levels to school for full-time in-person instruction. We have seen from the data, we have seen our anecdotal evidence from our clinical providers, our child psychiatrists, our pediatricians, how families are really struggling. Some children are suffering. And so this is an opportunity that we have seen with the data that we can safely return to school and support the emotional health and well-being of our school community, as well as their academic development. So looking forward to working with school districts and schools in pursuit of that goal. We've come a tremendous way. I can't state how proud I am of all of us on the call and our community for supporting our efforts to reopen schools. And it's been a long year, but we're here, and I know how privileged we are in Marin. There's many schools across the state and across the country that have not yet had the opportunity to return their students for in-person instruction. So glad we're here. And I think that last slide is just our contact information. So again, all the in addition to being science-driven and data-driven, we have aimed to be accountable and transparent with all of our decisions. So these websites are where we post that information, and having access to staying up to date with all of our advances, which hopefully will just be continuing to be good news, and we avoid returning to red. And we keep staying on course with orange, moving to yellow tiers with our commitment to vaccination and staying safe.
Okay,
Dr.
great.
Willis, any closing remarks?
No, I mean, I echo, I think the gratitude that you expressed, both Mary Jane and Lisa for it's one thing to write to think about the policies, look at the evidence, and try and write and keep up with the best practices from a policy standpoint. It's another thing for them to actually be practiced. And the hard work is actually what happens in real life every day in the schools. And so really any success we've had is courtesy of the hard work that everyone has done. And I think we have a lot to be grateful for as a community, that we've been able to probably as much as any other county in the state of California, have been able to balance safely reopening schools with controlling transmission. So thank you all. And we do want to open up, have plenty of time for questions.
Yeah, so let's go to some of these questions. Let me start with one global question that came up. That was, is the guidance that's being provided here of the 30-point plan related to the fact that we're moving to the orange?
Yes. Well, so it will not change. If we go back to these guidelines, almost all are not tier tied. They're universal, and so because they represent safe and best practices. In fact, the CDC's guidance is for almost any level of community transmission. That the exception to that is some of this youth sports guidance is actually tied to tiers, because of the different sports that are allowed at different tiers obviously relate to the community transmission rates.
So if we go back to red, this 30-point plan is in fact the plan we'll be following regardless, or purple, where we had been at the originally. Okay, so a couple of questions back to the travel. All right, so I'll go with this one. CDPH says stay within 120 miles or you must test 10. Many schools are following that. Then we're seeing this unevenly applied. Can I go on a plane? So one more time on spring recess travel, please.
You can travel. It's how you travel and what do you do when you travel and what do you do when you return from travel. If you travel out of state, you must follow a quarantine. There is a 10-day quarantine in effect after out of state travel, and then you could potentially test out at after day 5 once you return. Again, recommending the entire family get tested, not just students get tested, to end the quarantine at 7 days, after 7 days, if everyone in the household tests negative for COVID-19 after travel.
So a few more questions about the physical barriers. Someone just mentioned they just ordered plexiglass dividers in preparation for full return. Another question, what's the benefit of physical barriers for student desks? Is there research that supports physical barriers?
The CDC removed physical barriers from its guidance because there's no research to support the effectiveness of universal application of physical barriers in the school community, or even we see it everywhere. It's universally everywhere, at banks, at grocery stores, but we don't have strong evidence of the effectiveness. I think for many, it provided reassurance, a physical reassurance that that was protective that there's reduced transmission, but there's not evidence to that. And our concern is people seeing that as a reason not to be strongly implement things like face coverings and maintaining the 3 feet distancing. So that's why there's a shift in the CDC language.
On CDPH, it's similar, like California Department of Public Health has also removed any reference of physical barriers. Again, I think from the concern that Dr. Santor expressed of the sort of the false reassurance they may offer compared to other interventions.
Will any of these guidelines change as a result of adults being fully vaccinated?
I think we will see. I think this is our update that will get us through the end of the school year. I think what we'll be working together with over the summer is looking at continuing to look at research and data and how would we update the guidance. Where are we as a community and moving forward with even more relaxation for the fall year. So I think it will evolve over this, and it'll probably be one updated guidance to get us in, further update to get us into the fall year based on what we learn. Again, we're part of a large laboratory study. We're all getting vaccinated at the same time. So we are gonna see what Dr. Willis's slide is, there might be immunological inequity, both driven by how we have been able to vaccinate our community and as we are in a race internationally around vaccination. And again, it's really important to remember that Marin is not an island. And we are seeing nations across the world struggle with their vaccination strategies and with the emergence of these variants. So we have to be prepared, as always, since we've been in the beginning, to course correct and to adapt our recommendations and guidance to emerging best practices and research.
And it is, the CDC has been slow on offering, what does it mean for people who have been fully vaccinated? There's a few changes. One is that, you're probably aware that people who are fully vaccinated can be indoors with others who are fully vaccinated, even without masks. And there's also a change in the quarantine recommendations for people who have been fully vaccinated. So that's how one of the questions in the chat related to quarantine, and there's an exception there. For people who are fully vaccinated, the quarantine expectations that Dr. Santora outlined would not apply, consistent with CDC guidance that we do not need to quarantine if exposed, if we're fully vaccinated.
How can we get COVID tests after travel?
You just go to our COVID tests are widely available now. So we just would recommend going to our website or contacting your healthcare provider to complete a COVID test. And we have free testing still through our partnership with Curative across the county, and have that schedule posted to our website. So it's not how it was last March. Testing is widely available. Both.
Yeah, can I just reiterate that there's more testing appointments available each day than there are people seeking testing right now in Marin. So that should not be a barrier.
Several questions about sports. I have young children, sports are opening. How many teams can my children be on? Number one. Number two, sports teams, carpooling. Is it okay if the windows are down and the students are wearing masks? And how many adults can we have at a high school sporting event in the crowd?
So we are anticipating updated guidance. This will be where we falter. If I know the desire for everyone to return to normal and have a normal spring sports season like we wanted to have had last year, but all of the activities, again, related to sports increase risk. So it starts with pre-event gatherings. We're mixing households with different variations of immunization status, especially younger households are less likely to be immunized. Younger parents under the age of 50 are less likely to be immunized, and you're mixing households. Carpooling is a higher risk. If you have to carpool, yes, you can carpool, but with windows down and all parties, as few parties in the car as possible, and for as short of time as possible. At this point, sports competition should only be within the surrounding counties. And we know that that's not happening. The cases that we're investigating are individuals are traveling out of state and out of county, where you're going to higher areas with higher burdens of COVID-19, which is increasing the risk. And so that was why there was the strong recommendation from the state is that you have a parent or an observer, not even an observer there solely for the purpose of supervision. And that's, again, this is not to become an event, an outdoor event where that we used to have, where it was more like families would picnic and watch students and gather. Those are going to be potential COVID transmission events. And so this is where we need to work together, work with common sense, read the FAQs, which are evolving rapidly, because the state wants to be responsive. The state wants sports. They hear everyone wanting sports back, but it's limited still. And that's because our goal is getting everyone back into school and keeping them in school for the rest of the school year. It's supposed to be only one sport per child. So not both a school team and a club team. So one sports per child. It should be only one competition per day. So not multiple event days, but we are depending honestly on the private clubs and the schools themselves to follow that state guidance, which and check it daily because it is getting updated. We know drumline and cheerleading is now allowed. And I think that's what you're seeing where they're relaxing so we can start normalizing, but we have that risk of people slipping into behaviors that would increase the risk of COVID-19 transmission.
Can you talk a little bit about summer programs, whether it's, where will the guidance come from?
So we just received, just last night, it was hot off the press, the state has now changed its guidance where it relates to summer camps, where they had a limit of 14 participants. That will now only be the limit if we're in the purple tier. So the state also will be drafting a public health advisory just to point people to the right direction. The state does have guidance established on how to operate summer camps and summer programs and childcare. And we would be expecting programs in our county to follow that state guidance. So we no longer have the 14-person cap that the state had invoked earlier on there. But absolutely, people need to review those longer documents if they're going to plan for summer activities and childcare activities and making sure that their programs are aligned and develop their own site-specific protection plan for all activities that are occurring in Marin County.
Mm-hmm.
And that's a great example of how rapidly things are changing. I mean, this is last night, state guidance. The way we're interpreting this is that they've basically eliminated the cohort size limitations outside of the purple tier. So anything red, orange, we're not constrained now by a number of students, and we're still now just digesting that in Marin as it came out last night, and we'll be offering our own recommendations by the end of the week.
Is this accurate? Number one, no social distance required if adult is fully vaccinated.
That's not, no, the Cal OSHA, the regulations with regards to student interactions from sort of the regulatory body is California Department of Public Health primarily. And then where adults from the occupational standpoint involved, Cal OSHA, Occupational Safety and Health determines that, they've determined still that 6 feet is the standard regardless of vaccination status. And that's an example of something that we would expect to change over time as we learn more about the vaccine, the protection the vaccine offers. But until Cal OSHA authorizes less distance, the standard is still 6 feet for adults.
Okay. Is it accurate that fully vaccinated adults may interact with other fully vaccinated adults without a face covering, assuming no non-vaccinated people are present?
Well, that's per CDC, yes, in your personal life. Per Cal OSHA, no, in your occupational life.
Okay. This is a different question, I think from a high school, but essentially raising the issue that CDC is clear that 3-foot distance is in conjunction with cohorts. Our school district has no cohorts, just mixing 500 to 1,000 students a day. So this would be a high school question.
Well, there shouldn't be mixing 500 students a day. Those students are assigned to classes and attend those classrooms, and then the schools have developed people movement plans to limit mixing and ensure that there's not clustering of students. So the campus is allowed on site, and again, students are able to attend classes with limited mixing. So the cohort, the way we now use the word cohort, is really for those individuals that have known close contact. And our goal is to create as stable groups as possible on all of our school campuses. So if there is a possible exposure, a known positive case of COVID-19, our teams can investigate and confirm if there's been any potential exposure on the school campus. So again, what we envision is a very structured, supervised environment at all grade levels that your educators and school staff are working to maintain. And again, also students playing a role in maintaining that. I know many want to be back at school, and I think the majority know how critically it is important it is for them to follow their school site specific protection plan, stay in school.
So this will be your last question. Will you be helping to encourage all school districts to follow the science and get kids back to school full time, not just hoping that they'll open?
Well, our jurisdiction in public health is limited to providing this guidance and collaborating and partnering. It is ultimately the school district or the individual school's decision on how they interpret and implement our guidance. And so we continue to show the research that has demonstrated the harm that school closures have caused for many families and students, and the benefits of closures and allowing the benefits of closure from a zero risk transmission. We're not seeing those benefits outweigh the harms. And so we can share that guidance, but it ultimately is up to the elected officials and school leaderships on how they interpret and implement that guidance.
It's an invitation, right? It's an invitation. We're removing barriers by offering reassurances by way of evidence and science and policies and practices, and having these conversations. I think that's one of the reasons that we're committed to this ongoing dialogue, because we recognize that at every step there needs to be support for people to take that step. It's not easy, especially in an environment where we may be outliers compared to other communities. And so we are inviting you in every way we can with the science we have to bring to bear to this, and want to stay connected. I mean, there's these conversations. There's also, even more important, is the everyday conversations that might happen between your public health liaisons and our staff as questions come up along the way to help you forward.
Okay, with that, thank you, Dr. Willis. Thank you, Dr. Santora. Thanks to all of you who participated in this webinar. All of the information, as I mentioned, will be available for sure within 24 hours. The recording may be sooner than that. And the data related to the 30-point plan is available on the website. It's also there, available, translated into Spanish, in addition to the template that will be necessary as people look to update their school site specific plans. Once you do that, if you'll forward them, we'll be posting them on the website. And as a reminder, for those of you that have questions about how your school is applying the guidance, the school site specific plan provides very specific information about how each school is approaching this. I've said this before, nothing about this effort has been cookie cutter. There is no one way to apply the guidelines within Marin County. As a community, we should have our shoulders back and be very, very proud of what has been accomplished. We will all agree there's more to do. And we want students to get back into school for more time. We have the protocols to show that we can do it safely. You saw we're at 1.5 million student days as of today, with only 11 in-school transmissions. And most of that was without any vaccinations at all. So we have this, we got it, we know what to do. And at this point, we are collecting data. We'll be providing it. If you go to the website, you can actually look at your school, whether it's a private, independent, or parochial or public school in Marin County, and see how much time students are in person at this time. And we have seen now that less than 10% of the members of our community are opting for a virtual only, while there are some that do, and that option is still available to people. So with that, I hope you can leave feeling proud. We know we have more to do, but we intend to do it. And thanks to everyone who's participated here. Thank you.